The Reproduction Regulation Department in China Medical Tourism is a medical research institution treating fertility and andrology, which combines treatment, research, and education in one. The department is equipped with ultrasound, computer-assisted sperm analysis system, chromosomes analyzer, carbon dioxide incubator, etc. Besides, there is a medical reproduction laboratory and a genetic laboratories. The high-end medical technology is applied into the clinic treatment here for the infertility patients. When we come to the department, we saw the doctor explaining the cause of the illness to the patient. You can see the electronic picture. The normal image shows this is the uterus, and the fallopian tubes are beside the uterus. The fallopian will appear as dark shadow when injecting the drug like this one. It becomes more and more obvious.
Male infertility is mostly caused by these reasons. He has no sperm or too few sperm, or the motility of his sperm is poor. Some are caused by sexual dysfunction. Female infertility is always related to the condition of ovary and the fallopian tubers. No ovulating, polycystic or ovary fallopian tuber infraction will all lead to infertility, as well as male development of the uterus and endometriosis.
Among all the diseases mentioned before, the most common one for the male infertility is the oligozoospermia and low sperm motility, while the female are more suffer from the fallopian tube infraction and the ovulatory obstacle. No matter what kind of disease, the priority is to find out the cause of the disease.
When treating male infertility, we always look into the cause of the disease. Firstly, to see if the oligospermia or low sperm mobility existed. If it is caused by viruses, a surgery is suggested. If it is caused by endocrine disorders or infection, a surgery is unnecessary. Drugs and sex hormones are recommended to regulate the endocrine and the ovulation. Surgery is suggested to cope with the pelvic physiologic enhancement and the fallopian tuberous infraction with the hysteroscope and the laparoscope. A lot of cases have been done in this type of surgery, and the pregnancy rate has reached over 50% in half a year. The pregnancy rate and the outcome of the surgery state that this is a successful therapy.
Traditional therapy like hydrotubation and antiphlogistic needle are effective to the light symptom, but to those terminal patients and heavy symptoms, it couldn't have effects. The 26-year-old patient having a drug abortion 5 years ago. She didn't adopt contraception measures in 5 years, but she needed to have the baby again. At first, she also tried hydrotubation and physical treatment, but the result is unsatisfying. Then she came to our hospital and we arranged a hysterosalpinography. The picture shows one of her fallopian tubes that's not developed, and the other side has hydrops and adhesion. Next, a hysteroscope is done indicating that the resistance to the fallopian tube is huge so that the fluid infusion is not fine. According to this, we arranged her to have anti-infection treatment and traditional Chinese medical irrigation anus treatment. Still, the result is disappointed. Finally, she accepts to choose the minimally invasive surgery. After the surgery, the patient carries on having traditional Chinese medical irrigation anus treatment along with the antibiotic therapy. 2 months later, a hydrotubation is operated. 3 months later, a follicular monitoring is done, and we luckily found that she gets pregnant in the 3rd month. Now she is going to be a mother, conceiving an 8-month baby. Her baby is good in health in all the screening and check-up procedure. Because of the accelerated pace of life, the heavier pressure and the polluted environment, there are more and more infertility patients eager to have a baby. It's necessary to have a pre-pregnant inspection.
This is coincident with the government policy to give a good birth and good care. Firstly, the male should take measures on the motility, quantity, and the quality of the sperm. Besides, some checkup to see whether he has infective venereal disease should not be neglected. Female should have the touch and checkup to eliminate threat of venereal disease. Also, the routine examination including BR and urine routines should be carried on. These are beneficial to have a healthy baby.
We hope that with the fast-developing medical technology, more and more infertility patients can come to firstcare-china to have their own baby one day, and the babies can grow up happily.